I was about to say good morning, good afternoon.
Hi, everyone.
Hey, baby.
Hey, we'll be starting the meeting shortly. Just want to remind our committee members, if you could make sure that you can be seen by the camera and maybe just test your mic, make sure we can hear you. I think we're still waiting on a few people to have a quorum.
Yeah, you have 2 committee members here, just you and Kim. And so you need 3 more for you to have a quorum.
Okay.
Hey, babe. This is Sean.
Hi, Sean.
While we're waiting, maybe it'd be a good time. I see Tanya Murphy's on. I don't know if we got a response to that email with asking the LGEs. I mean, I got some answers about it, that it wasn't what it appeared to be, but we had asked a specific question. So I just wanted you to know. I don't know if you were involved in all the other exchanges explaining that.
Are you asking me or Tanya?
I'm kind of asking you if you were aware of kind of the.
Yeah, I was aware. I don't know if I was
Okay.
involved in all the exchanges, but I was aware, yes.
You're aware that it was just a confusion and wasn't really a cut, a reduction or stuff. Because all
Right.
of it heard before the budget information even came, but we had asked Tanya to for them to answer some questions. I don't personally think those questions are necessary or would have yielded what was sought based on the information I've received.
Okay.
Hi, this is Tanya. I got my audio to work here. I had to do a couple of things, but I got it now.
Okay, hi Tanya. It looks like you're on like 3 times or something. I don't know, maybe that's mine.
On at least twice.
Wait, I actually see it 4 times.
Wow. Interesting.
So it looks like, Brenton, we now have 4 committee members that are on.
Correct. You just need one more and you'll have a quorum.
Okay.
Yeah, I think it lists me every time somebody that I forwarded it to joins, maybe.
Okay.
Yeah, any of the links that you get via email, it's a link specifically for you. So if you share it, then it just signs everybody in as you. So if anybody's listening to this, if you've signed in and your name, it usually has a name, can you please change it to whatever your name is? Because we have a lot of Tanya Murphys on.
Hi, everyone. We're just waiting to have one more of the committee members join to start so we can have a quorum.
Also, again, if you're an attendee, could you please check and make sure that your name is actually showing up? If you shared any of the links, it's not going to pull up your name. So if you could just go ahead and change your name so we can reflect in our documentation who was actually attending the meeting. Thanks.
And you change your name, if you click on the box where the name is, there's 3 little dots at the top right-hand corner. If you click on that, I think it'll say rename. It'll give you the option to rename.
Hey, can you guys hear me?
Hear you, Kelly.
Yes.
Okay,
Hey.
thank you. Sorry, I was having a lot of trouble. Muted, yeah. Oh, thank you for getting this for me.
I see that Robert is an attendee. He needs to be moved to panelist. Okay, so we have a quorum. Hi, everyone. I'll call the meeting to order, and those of you who are the committee members, if you would use your camera so that we could see you, and anyone else who's speaking, if you have the option to use your camera. So I'll go ahead and do the roll call now. Whenever I call your name, if you'll just say here or present. Kim Bazile,
Here present.
Randall Brown, Corman Setner, Julie Foster Hagan,
Here.
Hyacinth McKee. I think Hyacinth is here. I'll just go on. Hyacinth, if you get your mic unmuted, just indicate that you're here. Robert Patty.
Hey, I'm here.
Hey, Robert. Then myself, Bambi Palazola. Mary Torver. Crystal White. Okay, is Hyacinth? I see your name here, but you just have to verify that you're on. While we're waiting for Hyacinth to unmute her mic and her camera, we'll go ahead and do an introduction of the other people who are going to be speaking. I see Kelly Monroe is here with the Arc of Louisiana. Tanya Murphy is with OCDD. We have another member of our committee, Randall Brown. Randall, if you just want to say present so we can verify you're here.
I'm present. Thank you.
Hi, Randall.
Hi.
And let's see, who else do we have? I think everyone else is staff. Okay, so we have a quorum with Randall. Hyacinth is also listed, but hopefully she'll get connected and be able to speak. So the first thing on our agenda is the approval of the minutes. Brenton, can you click on the link to be able to, everyone can see that? Okay. So we'll just need a motion to approve.
I'll make a motion to approve the minutes from the previous meeting.
Thank you, Randall. Do we have a second?
I'll second.
Okay, so Randall made a motion, Julie second the motion to approve the minutes from our January meeting. Do we have any objections? Okay. And can I ask one of the staff members or someone to put the link to the meeting in our chat? So if anyone needs to just access that really quickly so that they can look at documents, because it's hard to see the entire document that Brenton's showing on the screen. So if someone wants to access that in a different way. Okay, so our next item on the agenda is our Office of Aging and Adult Services, Arc of Louisiana, and Kelly Monroe will, Kelly, you can share that report. You're muted, Kelly.
Sorry. Okay, so I guess Hannah must be sharing it right now. So or either one, thank you. So, okay, so I was able to, first I apologize for not getting the report done and sent to you guys with the rest of the reports. But I really wanted just to kind of close out the year because it just becomes difficult. So I apologize that you got it a week later than all the other reports. So, but when we closed out the year, in the fourth quarter, we served 46 people, but a cumulative total of 50 people throughout the entire contract year. Of those in the fourth quarter, we served 21 of those were African-American and 29 of those were Caucasians. 28 of those were male and 22 of those were female. If you turn the page, it kind of breaks down like where people were as far as like in Louisiana. So there were 5 in Region 1, 11 in Region 2, 4 in Region 3, 1 in Region 4, 6 in Region 5, 1 in Region 6, 9 in Region 7, 6 in Regions 8 and 9, and 1 in Region 10. So we did have some changes from last time we reported. So if we turn the next page, it talks about like what services people, when I see a typo, it says the second quarter, that should actually say the fourth quarter. So sorry about that. But all of the individuals, all 50 received support coordination. 36 of those people received personal care assistance. 3 of them were utility and rental assistance. 28 were medical supplies, and 3 were home modifications and vehicle modifications. So the contract year for direct services, we kind of set aside $827,075.51. We didn't quite spend the full amount. What we actually wound up spending throughout the whole contract was $814,971.41, which leaves like a little over $12,000. And that was really due to one person going in the hospital and one person, because of COVID, they couldn't finish the work that we needed. So we had to move it on to the next contract year. And it was a home modification. So we weren't able to do that, but it has the breakdown right there of the different services and like how much was spent in each one of those services. And so of course the highest is always going to be the personal care assistance, and with the lowest being the rental assistance. If you turn the page, they is where we have the waiting list information, and it's broken down by region as well. And for whatever reason, like we have nobody in region 1, which is so odd, but right now we just don't. We had a couple of people, but we served them using one-time funds. Last year, there was some medical supplies and a medical procedure that we had paid for or helped pay for. And it cleared out those 2 people. So we, at this time, we don't have anybody on the waiting list in region 1. The breakdown of what is needed is a little over $1 million. This past legislative session, we were supposed to go back and ask them for additional funds to kind of clear out the waiting list. It would have cost the state probably about $600,000 in state general funds in order to clear out the current waiting list right now of 65 people. But due to everything that was going on, we decided that it just would be best to kind of like, let's just move on and wait until next year before we make an ask, because we knew that we were already in a not so great position with the budget. So if we were to serve all 65 people, we would need a total of $1,216. But that I think in state general funds was close to $600,000 in order to get to that amount. So that is all I have for you today. Unless you have some questions, I'd be happy to answer them.
Well, first I'd like to welcome, we have another one of our committee members, Dr. Hyacinth. I think she has her camera and mic working now. So welcome, Dr. McKee.
Greetings.
And also just, I think when I went through who was in the meeting, Dr. Savicki with OBH is also on. So I just want to acknowledge her. So do we have any questions for Kelly for this report? Kelly, did you say that you had the $12,000 under budget and you explained why? I don't know if I missed it or not, but do you get to use that in this budget year? Just
We were able to roll that over into the next contract year. So we're going to use it for what we intended on using it before COVID.
Okay.
We're going to use it for the same thing. It's some home modifications and some medical supplies.
Okay.
Yeah. Yeah, this year, some of the medical supplies we had to wait because there was a limit on what you could get, where of course there wasn't before, but because of the shortage, everywhere there's a limit on some of those medical supplies. So we had to just kind of switch gears a little bit.
Okay. Any other questions for Kelly with the ARC? Well, Kelly, you're off the hook. You're
Yeah.
good.
That's the way I like it.
Okay. Next is Office of Behavioral Health. And Dr. Savicki will give that report.
Hey guys, can you hear me okay?
Yes, we can hear you.
Okay, great. All right, thanks everyone. So it looks like we've got the report up on screen. Thank you to the team over there. So, and this is going to be a little hard to review over Zoom, I can see, but we're looking at, of course, the child report for the CCR and the flexible family funds used for kids with behavioral health needs. And I will just do a quick review and then ask if anyone has any questions. So again, this is our Q4 report. This is not the closeout report. In fact, multiple LGEs specifically let me know, as per usual, that they're not at all done spending for the year. They have, certainly plenty of June invoices that they still need to process that they weren't processed by the time they submitted this data to us. So in general, for the CCR funds, thanks for expanding that so folks can read it. For the CCR funds, we see a lot of progress in the expenditures. I think you may recall for the Q3 data, there were several LGEs where spending was very, very low, particularly due to a number of LGEs, how they structure their spending. For instance, using their mental health block grant funding first, which needs to get out the door first, and then only then using their Act 378 dedicated funds. And so you'll see for those LGEs, I think we had maybe a couple of LGEs at 0% expenditures for Q3, and obviously there's been a lot of progress on expenditures since then. There are some LGEs who are reporting some difficulty with connecting with families and connecting with family needs based on the pandemic. Certainly families are not coming into the clinic in person the way they would have regularly. So there have been a few barriers reported by some LGEs in trying to get the funding connected to families, just given changes in how families are using services in the past several months. I'll pause there and just kind of open it for any questions on the particular data that's up on screen right now, the Consumer Care Resources funds.
Does anyone have any questions? Okay. You can go on. Thank you.
Okay. If you can scroll over to the flexible family funds, nothing really of note there. LGEs are typically very successful at getting those out and certainly oftentimes maintain a pretty large waiting list of families that are interested in that support. Although there are at times, certainly once kids age out, for instance, one LGE I know is having some trouble. They've had a couple kids age out and then one family move out of state, and they've had some difficulty getting contact with individuals on their waiting list in order to fill those slots. But in general, most of those slots are filled, and those expenditures are getting out to families. Any questions on that?
I have a question in regards to, I think it's, is it no? I guess it's the one, the North in Monroe NLHSD. They have a balance of almost 15,000, and I don't see in the explanation.
So that's that's actually the LGE that so they have 19 slots filled out of 21. And they're the organization that is having some difficulty working through their wait list to fill those slots of a couple kids who aged out and one family that moved out of state. So I would believe that would explain the unexpended funds. There should have been a reference in the comments or in the notes section to them attempting to fill those slots.
I see it now. It says we are working to fill our cash slots.
Okay, great.
But they actually have
great.
10 people on their waiting list. So, okay. Any other questions? Okay, if there's no other questions, then we'll have the adult report from OBH.
Yep. Yeah, and this one is pretty unremarkable. These funds are typically LGEs. There's only a few LGEs that have historically had these funds allocated, and they're pretty successful at getting these funds out the door and connecting individuals to this funding. So you'll see that they're pretty much all done getting the expenditures out, with the exception of Central, which has a bit more to go, which likely will be resolved when we get the closeout report, because they didn't have the June invoices tallied up yet.
Do we have any
Any
questions
questions?
on this report? Well, they're letting everyone off easy today. Thank you very much.
Thank you.
Okay, Julie, we'll see if you're just as lucky. So we have Julie and Tanya, the Office for Citizens with Developmental Disabilities. And the first report is the Act 73 compliance report. I think, is that what we're looking at first, or? The fourth quarter of the Act 378. Okay.
Tanya, you want to take it away?
Sure. So I was looking through this individual and family support section of the quarter four, and just like Dr. Savicki said, this is not including all of the invoices for the year. So this is not the end of the year report. All of the LGEs did have notes to explain if there was any money left over. I'm looking at Metropolitan Human Services District, where they have spent 64%. And they noted that because of COVID-19, all their day habilitation programs closed, and that directly impacted the expenditures in the IFS program. I know that generally you would budget almost $6,000 per person per year. And if they close those day hab, then you would have to cancel all those contracts and then try to spend it on something else. I'm sure that they will have a different percentage and amount expended at the close of the year report that comes out later. I also wanted to bring to your attention the budget changes column, and note that Acadiana area added $400,000 to what they had originally budgeted. And Region 7, Northwest Louisiana Human Services District added $340,000 above and beyond, which might explain why some of the percentages are a little lower. But most of them, from my communications with them, have all said that they'll be spending the maximum percentage by the end of the year, once they get all the invoices and all the spending is done.
Tanya, when was for Acadiana and for, is it Northwest Louisiana Human Service District? When was that those additional amounts added to their budget?
I'm not sure of the date. I'd have to go back and look at the previous quarters and see if the budget changes were reflected.
Okay, so I was just wondering if it's from my last meeting, if that change was from our last meeting. I didn't look either. Okay.
Hey, Bambi.
Yes.
This is Linton. We do have a comment from Melinda Elliott saying IFS money is spent on day habilitation. Is that correct? Both of those were questions.
Yeah, sometimes they do contracts if they can provide that. If an individual cannot qualify for Medicaid and then they cannot get a supports waiver, then family support provides a day habilitation so that the individual can go and do something during the day, and that does help preserve the placement in the community. So it does fit into the guiding principles of the individual and family support funds.
So this is Bambi in regards to that comment, because I was thinking along that lines, like how many people are we paying for day hab programs through ISF funds? And then for your comment, Tanya, what you said people who don't qualify for Medicaid, and I know these people have to qualify as having a developmental disability, so it's not on that component of it. So it could be that they don't qualify for Medicaid because of their resources or income.
That's right.
Are there that many people that, because that seems like a lot of people receive,
Yeah, I don't think that would cover all of them that are paid through the IFS. There's probably some more individuals that just for some reason or another aren't considered a priority 1 or 2, or aren't considered priority 3 or 4 on the sun screening. So they haven't gotten a waiver offer, and they're just continuing to fund through IFS until there's a change in the family situation.
And so is that like, so that this is state general funds, wouldn't it be a better use of the funds if they had a waiver, which would have federal match? Wouldn't that be using less state general funds? Right, and so, because this is all state general funds that's paying for it, right? And then, but if they had a waiver, it would be the match of the federal and state funds.
Right.
Is that correct?
And it's kind of it's a departmental decision whether we want to use up all of our waiver slots and give everybody a supports waiver, and then we wouldn't have waiver slots available for individuals in emergency situations if they're being supported right now and they don't have any other needs besides the day have. It's just been a departmental decision that if they're being supported now and there's no crisis or need for additional services, that they are staying where they're at. If there's some change in circumstances and they have other needs, then they're being sent through the sun screening again to see if they would get a 3 or 4 and get a waiver offer. But I hear what you're saying. It's kind of they could get a match back on their waiver if they got the supports waiver instead. But we would run out of waiver slots if we gave every single person who was getting DAHAP through IFS funds a supports waiver.
Okay.
Hey, Bambi, we do have 2 comments in the chat.
Okay.
The first is from Ashley McReynolds. It says, Capital Area Human Services District finally got the money back that was going towards the Families Helping Families contract, and it was put back in January, but the changes in budget don't seem to reflect the amount. Can someone look into this or explain only a little over $1,000? And then our second comment is from Melinda asking if we have data on how many people get DAHAP through IFS in the state.
Yeah, we do have that data.
Is that part of a report that you give us, Tanya, or?
I think it is divided out on the information that I sent in, where it separates the individual services that are provided. I think it is.
Okay.
I can't speak towards the Families Helping Families question. I'm not familiar with that.
Yeah, Ashley, I'm unclear on what you're saying as well. If you want to be moved in to be able to speak to explain it, that's fine. I don't know how to indicate that that's.
Can you hear me?
Yeah. Hi, Ashley.
Okay. So, oh wait, do I need to turn my camera on or?
If you would, just so we can verify it's you.
Okay, let me try and figure out how.
If not, that's.
I'll promote you to panelist. You can have a short break.
I'm sorry, Sean, what did you say?
To show her, she needs to be promoted to panelist. So I promoted her to be a panelist. Now just
Okay.
for that it kicks you off and back on very quickly.
Okay, I see you, Ashley. I can't hear you. You're muted, Ashley.
Okay, better?
Yes.
Okay, so for a number of years, the individual and family support dollars were funding the contracts at Families Helping Families. We finally got all of that straightened out, and it was removed from the individual and family support budget and just funded through Capital Area. And they gave Capital Area back the money that was not expended, I believe, from January to end of fiscal year.
That was done at we just had a meeting today. So in our like March meeting or April meeting. So that number, we should have had a fairly substantial increase in our budget. I know it's more than $1,300. So I was just wondering if there was any additional information on that budget change for capital area. And I think, Tanya, I had talked with you about this, like when it was happening, I guess.
So when Families Helping Families gave their money back, is it because they weren't going to be contracting with them anymore or providing services for those months?
No, it was being, it was funded not with the Act $378. So they moved it, they just shifted the funding mechanism.
Right. So they're still getting paid out of state general funds. It's just not being reflected as coming out of the IFS budget.
Right. But we were told that IFS got like a significant amount of money, and I don't want to quote what we were told in case like I'm just not accurate on my numbers, but it was a substantial amount of money that we got reimbursed for because it was wrongfully taken from the IFS money anyway.
Well, I don't know. I can't speak specifically to that. I can tell you that there's a possibility that that money was put back into the Capital Area Human Services District State General Fund budget and not necessarily put into the Act 378 because their total budget does meet what's required, which is the 9%. But I don't know about what was discussed in that meeting and if the money that was given back was going to be earmarked for IFS or not.
Okay. I'll follow up and ask. I thought it was sent back. And I know that Capital Area staff was excited that we were getting that money to spend in IFS. I know Corliss and I had multiple conversations about it. And she was excited that we were going to get to use that money to fulfill the needs because we had the most requests this fiscal year than we've had altogether. And I don't know if anyone from Capital Area is on. Corliss or Shanitha or.
She just sent a response.
Yeah, Shanitha just sent an answer. The money is already included in the total. The 1358 is from FFF, Flexible Family Funds, when a participant went into the group home. The additional funds this year came from the vocational contracts due to COVID-19.
So the money that was put back in there is already reflected in the money that's shown in the Capital Area initial budget and the total budget that's 606,000 does reflect the money that they added back in there when they stopped showing Families Helping Families contract in there.
Okay.
Okay. So do we have any other questions on the IFS part of the report?
We had another comment in the chat from Susan Reen, and she was asking if it was just in Region 2 that IFS funds were going to Families Helping Family Centers.
I think that it was never it was
Act 378 funds, right? Not necessarily just IFS.
It was reflected in Northeast Deltas for a short time, but they stopped showing it in as part of what they were doing was they were showing the $58,000 contract for Families Helping Families as part of their individual and family support. And then they were counting that towards the 9%. Once we told them that they couldn't count that because it wasn't for specific services to individuals, then they took that $58,000. That's a separate expense out of state general funds now, and they no longer counted in IFS. And I think it was only Capital area, Northeast Delta that were doing that. Just for, it's not in there anymore now.
Okay, any other questions about the IFS portion of the report? Okay, so Tanya, you can move on to the next portion.
Flexible Family Fund, I think the percentages always look a little bit better because it's easier to anticipate that if you've got the slots filled, then your June expenditure is spent. So it doesn't lag behind as much as the individual and family support does, where they have to wait for invoices to come in. So, you know, most of the regions have spent all of their flexible family fund money. The budget changes that you see reflected in there that are in parentheses in red, a lot of that was the result of guidance that came from OCDD, that because of COVID-19, they weren't going to be able to do face-to-face interactions to complete the initial eligibility for new flexible family funds. And so they moved some of the money over to their IFS so that they could spend it more effectively. So you're going to see some places where it shows the number of budgeted slots is less than the number of filled slots. And that's a result of the guidance that was given. We have recently told the LGEs that if they feel comfortable creating a socially distant, safe way to complete those initial flexible family fund eligibility screenings, that they can proceed. I think some of them are trying to do it like out in the parking lot with in the car, or with good social distancing and masks in their office. So I think they're all exploring how to start doing those initial flexible family fund eligibility determinations again. Questions about FFF?
Doesn't seem to be any.
So the next is the Act 73 compliance report. So many of the LGEs have spent above and beyond the 9% that is expected. The couple of them that are a little bit low, Metropolitan and Central Louisiana, have both indicated to me that they do intend to spend all the money, and when we get the final report, it will show that they have expended their 9%.
So this is Bambi. It's just interesting to see the numbers, the percentage. You know, some of them are extremely higher than the 9%. And so I'm just wondering, like, what is the difference that causes that to happen? Or go ahead.
I would think it would be just the executive directors and their boards and how they decide to disperse the funds. And if they have money from other sources that they can put towards their Act 378 programs, then they do. And if they don't have the extra money, then they can't.
So the 9% is of the state general fund, right? That's not including, they could have other funding sources that's not included in that, correct?
Right.
Okay.
And this is Julie, just to confirm for next year, it's the state general fund, and there was some what we call interagency transfer swap related to the CARES Act funding to help replace where we didn't have enough state general fund. And so clarification has been given that that amount will be the state general fund, and the interagency transfer means a financing swap that are considered in the 9%.
So for, and this might be a technical question. So they have this dollar amount for state general funds, and then the LGEs can bill or have other like funding to pay for some of their other services, like behavioral health services, correct?
That's right. Their OCDD services don't bring in a lot of, but the OBH services, they bill Medicaid for a lot of their services. So they have an income source there.
And so the
There are
LGE
also other ways. Yeah, there's also other ways beyond that, Bambi, and each one of them is a little bit different. Because they're considered quasi-governmental entities, there are some things that they're able to do, even though they're partially funded as a state agency, that other state agencies are not.
So the state, so basically the OCDD services, or the developmental disability services, that their funding source is state general funds, right? Almost completely. Whereas the behavioral health services are state general funds and whatever those other sources are, billing Medicaid or other like federal grants or that type of thing. Is that correct?
Yes, there's not there's no quote unquote billing for any of the OCDD services that they provide.
So all of the billing that they do in those other sources is paid for behavioral health services. And then of the state general fund money, 91% of that can go to behavioral health services, and just 9% of it has to go to developmental disabilities as their sole source of funding that, correct?
Well, remember that the state general fund they're getting is also covering the salaries for their waiver staff and for the folks who do PASSAR and the folks who do, there's several different activities that they do for OCDD in addition to the Act 378 programs. So those state general funds have to cover the salaries for all of that. And Tanya, I don't know if you were going to add something else, but on the DD side, that there's a, that it has to cover all those things.
And it covers their administrative costs and the all the other expenses. If it's not 91% to Office of Behavioral Health and 9% to DD, that's not how it breaks down.
Okay. And I guess the other part of that too is that our DD services are more centralized, and we have waivers, and that comes from the central office, where behavioral health, it's mostly, almost exclusively, that comes from those local entities. So that's another reason, correct? So
Kristen, you may want to jump in here. The behavioral health side, they can be enrolled as an MCO provider and do billing that way. And there's also some work they do with us directly with uninsured. So I'm definitely not the expert on that. Kristen, I don't know if you can expound upon that.
Sure. Could you repeat the question? I was getting a little lost in the Act 73 stuff, which I'm less familiar with.
Okay, so my question was about the breakdown of fundings with LGE. So it seems like for this Act 73 compliance, that 9% of the total state general fund goes to DD services. So then you have another 91%. Now, of course, some of these LGEs spent more than that requirement, but we talked about, but some of that money goes for the administrative costs. But then another important thing is that for our DD populations, that many people receive waiver services, which come from the state office. That's not part of LGE's funding, really, except for administrative that they might do. But for behavioral health comes from that actual service that the LGE provides at that local level. Whereas at OCDD, at the DD department of these LGEs, it's basically these two different programs, flexible family funds and individual family support funds, and then just administrative type things. So there's just a different kind of way that the structure is, the structure of those two agencies.
Yeah, definitely. Yeah, there's certainly difference in OBH's relationships with the LGEs as compared to OCDD relationship with the LGEs. For for behavioral health services. I think as Tanya was saying, LGs can, and all of them are, enrolled as, Medicaid reimbursable providers of behavioral health services. There are also a large network of private providers out there that provide behavioral health services. So the LGs are not the sole behavioral health service provider in any area. But the LGs provide behavioral health services through funding, primarily from Medicaid. At least recently, given Medicaid expansion, Medicaid is a pretty large source of funding for LGEs, but they also do have grant funding. They have the ability to serve the uninsured. So there's a whole mix of funding sources for the behavioral health services, but not a lot. The state general funds on the behavioral health side would be mostly used for folks who are uninsured typically, and for salaries and everything else obviously that the LGE does. Does that help with the question?
Yeah, thank you. Now I see Sean has his hand raised.
Yes, I'm sorry. Thank you for recognizing me, baby. I can't electronically raise my hand. It's my understanding that there is that administrative costs are not to be considered in this 9%, and that is non-Act 378 services. That has been a long-standing understanding of the council. And so y'all kept bringing that up, but
No, Sean, what I was saying, that's exactly what we were saying. The 9% goes to the flexible family funds and the IFS funds, but it's not like 91% all goes to behavioral health. What they were saying, the other 91% covers their, the administrative costs as well.
I'm sorry. It just kept, what I kept hearing was confusion related. So
I'm sorry that my questions were confusing, but I think that people sometimes get confused about how those services are delivered in those different offices. And so I just wanted to ask some questions. Any other questions about this report? Okay, Tanya, do you have another report?
Nope, that's it for me.
Okay. We do have this, what is it?
I think, Tanya, were you going to speak at all to the approved funding report that you had sent in?
The IFS. Oh, yeah.
Oh, I see. Yeah. I certainly can. I provided this report as of June 10th that breaks down what was purchased. Let's see. I don't have a copy of that pulled up on my computer, so you'll just have to go with me here. Let me open it up full. Okay. So vocational employment, that was one of the questions that y'all had, and that's on this report.
I don't think the link to that, is that link in our, in the agenda? Where's that at? Oh, okay, thank you. It's the second link on OCDD.
And so on this report, so if you scroll, it's definitely hard to see on a computer screen, but the first 2 pages, I think, of this report is just kind of breaking down the other 7 pages of information. So at the last meeting, there was a request to kind of see the services that were approved pending funding, whether that's in whole or part. And so this information here is what Tanya sent in that was pulled from their system as of June 10th. And it kind of lets you know the region. I will say in this report, it's every region with the exception, I guess I should have my video on, sorry guys. It's every region with the exception of, it's Region 2 with the exception of 1 request was from Region 1, but the rest of these approved pending fundings were from Region 2. And so it's broken down by the list of priorities, 1s, 2s, 3s, 4s, and it kind of lets you know the date of the request, the amount requested, and it'll tell you if it's reviewed, if it's approved pending funding in whole or in part. And so that's what these pages you're looking at now show. If you go back up to the charts here, it just breaks all that information down so you can get all the information you need about incontinence supplies, If it's any sort of household or living expense, any of your vocational employment, sports, personal care assistance. So that's what the chart does. It's a lot of information. There's not a really nice, clean way that I could think of to break it down for you guys. But I know some people prefer to just see kind of what's in the charts, which is why that's there. And some people actually want to see all this information specifically. So that's why you have that kind of broken down that way.
Yeah, and I misspoke at the beginning when I said, that was one of the questions that was asked earlier, because what was asked earlier was how much was being spent on vocational. This shows the approved pending funding report. That is the requests that have been made, that have been approved, but there's not enough money to cover the request.
And we do have a question in the chat from Ashley, and she says, so are we to assume that capital area is the only LGE that does this? And then from Melinda Elliott as well, basically this is from region 2. Can we get this information from the other regions? Well, I think from other regions, I mean, this is, I mean, Tanya can explain, but I think that's just the way it fell out.
Yeah, this is the statewide report. And so, I can ask the other LGEs why they don't have any on here, or, why if they're not using this function. But when I run the report in our participant services, this is what's for the whole state. There's just a few in region 1 and the rest are in 2.
So this is Bambi. So this is what they have pending that they weren't able to fulfill, right? Is that correct? Okay,
Right.
so that it has to be that there's no way that all the other regions are filling every request that they received. I think that'd be great if that was the case, but there's something more to it. So it's a function that they have to input this data in order to generate this report, correct?
Right. I mean, there's the possibility, like these are requests that are approved. They go through the committee and they're approved, and then but they don't have the money to fund. It could be that the other regions are like, we only have the money to fund priority 1s and 2s. So the committee's only hearing 1s and 2s, and they're holding the other ones aside. And so they're not approved pending funding. They just haven't even been presented to the committee because they know they couldn't fund them. These are just different ideas as to why maybe some of the LGEs don't have a list.
Okay, and I think Jennifer Purvis from Northeast Human Service District has a comment in the chat.
Yes, she says that Northeast Delta had funded all requests, is why we're not listed as having people with requests without funding possibly. Ashley McReynolds had asked a question too. Does this practice not allow someone to appeal?
You mean if they're not heard, if the request isn't heard at all? Or which one?
I'm not sure. I don't know if she's still on, if she can jump on and clarify.
Oh, I was trying to type. Can y'all hear me?
I can hear you, Ashley.
Okay, I was saying approved pending funding. Does that void an individual's right to appeal?
They can't appeal if they were approved in whole pending funding. They can appeal if they were approved in part, which means they didn't get their full request, but they can't appeal because only because there's no money there to fund it.
Okay. Thank you.
So, Tanya, this is Bambi. Can you just find out if that, like, what is the process that's causing Region 2 capital area to have this report, and what are the practices of the other region? I know with Northeast Delta, they said they just approve everything. But is that the case everywhere, or there what the way you explained it could be a possibility? So could we find that out?
Sure.
Okay. Any other questions about this report?
Melinda had a question, wanted to know, when do these committees meet? I don't know specifically what committee she's referring to.
I'm assuming it's the Individual and Family Support Committee that approves the requests. And every LGE does it differently. I know some LGEs meet weekly, some monthly. It's just kind of depends on the need and how many requests they have. They schedule them. There is something in the policy about requiring them to meet a certain number of times or quarterly or something, but I can't remember exactly from the top of my head, but as needed or more.
Tanya, also in relation to that, is there a requirement for the makeup of these committees? Like who are members of these committees at the LGEs?
Yes, the policy states exactly who's supposed to be on there. We are updating the IFS policy, and I think it might have tweaked that who's supposed to be on it. It already says in the policy who's supposed to be on it, but I think that the new policy says a couple more things about it.
And I think that's the next item on our agenda, if I'm correct. Okay, so we can look at it then.
So we do have a couple of more comments. The first is from James Lewis. He says priority ones and priority twos were funded in Imperial Calcasieu and some priority threes. We have some priority threes and priority fours that were not presented to the FSC because we did not have the funding. He says they meet weekly there. And Ashley asked if families get notified that their case will not be heard if they aren't a priority one or two.
I'm not sure. I mean, it would be best practice, of course, to let the families know that they're not hearing. I think that they do let the families know if they're just not funding priority threes or fours. But I'm not sure if that's spelled out in policy.
And so am I to understand that before these requests go to the committee, the Family Support Committee, that somehow it is determined that whether they're priorities 1, 2, 3, or 4, and who makes that determination before it goes to the committees? Because isn't that the role of the committee to determine what priority it is?
The priority is determined by the case manager. It can be if it's a private case management, like if somebody has a waiver, then they would fill out the prioritization, or the community service professional at the LGEs will determine the priority. It's ultimately the developmental disability director of each LGE that assists with determining if a priority that's been established is accurate. I know that when you have somebody who goes through system entry and there's a need for a service, there's usually a handoff from system entry to the individual and family support community service professional worker, and the priority is established at that time. And also it's important to keep in mind that individual needs have a different priority number. So it's not just a family member that is a priority one. If they have 3 requests, one might be a priority 1 and one might be a priority 4. So it doesn't mean the family doesn't get anything. It just means they don't get everything depending on the priority.
So we have a couple of additional comments. One is from Ashley McReynolds, and I guess another comment in addition to asking about families getting notified if their case won't be heard. She asked if there's something in the manual about it, and if not, can it be added with the changes that's currently happening? And Hyacinth McKee, she said, can we ensure that policy includes families who are priority 1 and priority 2 are notified? Families need appropriate follow-up and results of the determination. And we had another comment from, sorry, looks like the name is cut off here, Shanitha Smith. She said in capital area, they meet weekly to present all IFS requests. Every request is entered in PSD and the family is notified in writing of the decision. Priority is given by CSP and supervisor, signs off. The priority can be changed in the committee if needed.
Okay, and then Jennifer Purvis said that's the same thing that they do at Northeast Delta. So I guess my concern, maybe I'm not understanding, and maybe we'll talk about that in the next section, is that, and James Lewis said the same at MCAL, that if some decision is being made before it gets to the committee, and maybe I see that Janitha said that the priority can be changed by the committee for at capital area, but if requests aren't brought to the committee, then that wouldn't happen maybe in other LGEs. So I just like to have more information about how that works.
Okay.
Are there any other questions on this report on the pending funding of IFS? Okay, if none, we can go on to the next item on the agenda, which is the IFS CCR work group recommendations.
It's me again.
Yes.
So the individual and family support manual revisions were completed. They were sent out for feedback, and the feedback time window has closed. And I now have it back in my inbox to look over all of the feedback and incorporate that into the changes, and then we'll clean it all up so it looks pretty, and then hand it over to Julie and the executive management team at OCDD for a signature. So it's sitting for me to look over right now with all the feedback.
But just to confirm, Tanya, it's not too late to consider the feedback you got today, right?
Right. No, it's not. I wrote it down because I can still make changes. It's perfect timing.
So do we have any questions on that report?
Once we get the IFS manual revisions approved, then I'm going to be providing a training to all the LGEs. And I want to start at the beginning of a quarter. So I'm hoping for October 1st.
Okay.
And for those of you who don't know, that was her hint to me to hurry up.
Well, nothing to do until I give it to you. And it's,
Kidding. I'm just
I get kind of obsessive when I know it's almost done and it's going to be signed, because I don't want there to be any typos at all.
Well, you're a good person to have on Julie's staff. I know
Well,
Julie appreciates that.
I'll log off so she can tell you the truth.
So are there any questions about that that report, that IFS CCR work group recommendations? Any questions or comments? See, Ashley said thank you. Okay, we're way ahead of schedule, but that's good. No, we all have a lot of things to do. So we'll move on to the next item, which is a discussion of flexible family funds eligibility requirements. And so this is added to the agenda because there was some discussion, or I received communications in regards to the eligibility requirements of the having school eligibility, like a 1508 type of eligibility, I think that has been addressed in the recommendations, but can you explain that, Tanya?
Yeah, it's not a requirement anymore. It used to be that it was only autism that allowed for a licensed health professional to provide a report that says that the child's condition meets the criteria of that exceptionality that they're saying that their child has. But the new flexible family fund policy now says that any of the exceptionalities that we accept flexible family fund the family can turn in a report from a licensed health professional that says the child's condition conforms to the definition in the 1508 bulletin for whatever exceptionality they're saying that they have. So, you can't have, it has to be within the scope of the licensed health professional, and the LGEs will, you can't just have like a physician write on a prescription pad that a child has autism. But we have opened that up to allow for, they don't have to have a 1508 to get flexible family fund.
So if a medical professional, like if they're not qualified to actually to do a 1508 evaluation, but they have to, like you have to get that documentation from a medical professional to say that they would meet what aligns with 1508. So what happens if a medical professional doesn't have that?
We don't want to question licensed health professionals. They make their own decisions clinically, what they can and can't do. If they're willing to say, I'm a licensed health professional and I'm writing this down in a report that this child's condition meets the 1508 criteria for whatever that exceptionality is, then we're going to trust that they know what that exceptionality is and that they're doing it. Even after they say that, the child still will have to come in for the severity screening test. And so, we will still see the child individually face to face to make sure that they have a severe disability that meets the criteria. So, we're going to have, there are some guidelines, but we opened it up. We didn't want to be the school police and say, you have to be in school in order to get this program, but it's a double-edged sword. You say you don't have to be in school, but then how do we decide you have this exceptionality or have this disability? But, I would say the LGs have a pretty good understanding of what the licensed health professional needs to have in their criteria or in their scope of practice to be able to say that this child has this disability or not.
And so I guess, but on the other end of the spectrum, if you have a child, let's say that's homeschooled, and then your medical professional that your child sees says, I can't, your child clearly has whatever autism or whatever that diagnosis is, but they say, oh, I'm not certified or whatever to be able to do, 1508 criteria. And then that child and family is like kind of out in lingo. They don't have the school diagnosis and they can't get it from a medical professional. So is that
any child, even if they're homeschooled, can go to the pupil appraisal office and have an evaluation done.
Okay, I see. Has Liz been moved over to be able to speak?
I'm here if you can hear me, Bambi. Thank you.
Hey, Liz.
Yeah, so what I just wanted to address is I know this was one of the things that we had addressed when we had met with the FFF ad hoc a couple years ago. That was one of our concerns is that they're using the educational criteria for kids in school and those different diagnoses and determinations of eligibility to determine whether or not they can be fall under the flexible family fund. And my concern is only, I know we changed it and had changed it to the evaluation. I just want to make sure it's not going to be this difficult position, because I think moving forward, because of COVID and because the amount of families are probably going to want to keep their kids home, I think we're going to run into a lot of issues where these people may be facing whether or not they get kicked off of FFF or whether or not they can't even get on it because they've decided to homeschool as opposed to being in the schools. Not every parent wants to go get their child through pupil appraisal and get that recommendation, or they get that evaluation. That's part of their personal preference to not have to do that. And some of it is because of diagnoses, not wanting to get their children basically labeled through the pupil appraisal, but at the same time knowing that they have issues that need to be addressed, and that they tend to be on the severity level, but also wanting to try to figure out how to make it work without having to have that label on them. So I think we just need to consider that. I don't know if that means opening back up the FFF and starting to look at that again, but it's one of those things where I've always had that as a issue, using that as the criteria to determine whether or not these kids are eligible for flexible family fund. Thank you.
Thank you, Liz. Yeah, I remember we had a really robust discussion about that in that committee a few years ago. So that is concerning, that, because like you said, people can always go, if they're homeschooling, they can always go to the pupil appraisal center in their area and get their child evaluated. But as Liz said, that some people, that there could be reasons why there's barriers there. And so I thought we had kind of had disconnected that by having the medical doctor be able to do it, a medical professional. But if it's tied back to that school criteria, it could cause some barriers. So that was basically it on that. Does anyone else have any comments about the flexible family fund eligibility requirements? Okay. Do we have any other announcements or comments? Okay. Well, thank you all. We can adjourn early. I assume, do we need a motion to adjourn? Yes, it's a formal meeting, so we do. Can we have a motion? Anybody want to leave?
I would like to submit a motion to adjourn the meeting.
Thank you, Dr. McKee. Anyone want to second it?
I'll second.
Thanks, Julie. If there's no opposition, we'll adjourn the meeting. Thank you, guys.